Okay, so welcome to Eat, Move, Think, the show about optimal wellness brought to you by Medcan.
Wow. Do it again.
Oh, I was practicing. Okay, ready?
Welcome to Eat, Move, Think,
the show about
optimal
wellness brought to you by
Medcan.
Yeah, this is extremely good. Thank you.
Can we talk about Medcan's Medical Advisory Services program?
Yeah, let's talk about it. Let's talk about what it is. What do they do?
Let me read you what their official thing is. They provide tailored and pragmatic solutions overseen by a dedicated chief medical officer to meet some of Canada's largest organizations' specific health and wellness priorities.
Wow. So what kind of organizations are we talking here?
Huge, like some of Canada's biggest employers. So Starbucks, McDonald's,
wow.
Walmart,
Wow.
Toronto International Film Festival.
Oh, cool.
MAS really is helping to redefine the future of workplace wellness. And so in this episode, we thought we'd talk to some of the key people behind the MAS team to get their guidance on what employers should be thinking about in terms of emerging threats and trends, workplace wellness, how to mitigate rising benefits costs, sick leave trends, short and long-term trends that promote employee retention and engagement.
So if you're one of those people in human resources or a leadership team that helps care for employees and customers, then this is the episode for you. It's full of some really great ideas.
I'm Chris.
I'm Jazz.
We're the producers of Eat, Move, Think.
The host today is Mark Beairsto. He is the program manager for Medcan's Medical Advisory Services.
Our guests include Dr. Alain Sotto and Dr. Matthew Burnstein, who are occupational health physicians and family physicians, and they've been advising corporations on occupational health matters for 35 years each. Lots of experience here.
Wow, some heavy hitters here. Let's get to it.
Here's Mark Beairsto, MAS's program manager.
Hello, everyone, and welcome to Eat, Move, Think. My name is Mark Beairsto, the Program Manager for Medical Advisory Services at Medcan. And I'm really excited to have two members of our Medical Advisory Services team, both Dr. Matthew Burnstein.
Hello.
And we have Dr. Alain Sotto.
How do you do?
We've seen lockdowns, we've seen new variants, we've seen multiple waves. How would you describe the current pandemic situation, and why might it be important for employers to keep thinking about how it will continue to change? Maybe Dr. Burnstein, we can start with yourself.
Well, we are still in the midst of the pandemic. While the numbers have been trending downward, which is a very nice thing to see, and the wastewater data, which is perhaps the most reliable data because testing is not being done consistently across the country, but wastewater data does give a good indicator of what's happening, shows a plateauing, which is good news. However, it's plateauing at a moderate level. So there's still lots of disease out there. Lots of people are getting ill with COVID for the second time, sometimes the third time, which is certainly adversely affecting individuals' abilities to go to the workplace. So there's no question the pandemic is still ongoing in Canada. And if one looks around the world, certainly in Europe, the numbers are generally going down, but there are still some very hot spots. Japan is hot, Taiwan is hot. It is a concern.
And Dr. Sotto, yourself, why do you think it might be important for employers to keep thinking about the pandemic and keep thinking about how to protect their employees?
Just to put it in perspective, in Ontario, we had 56 deaths in the last 7 days. And that brings our total death count in Ontario to 13,869 lives that have been lost. So this is not a disease that you could just, oh, it didn't really affect me. Well, the reason it's not affecting you that badly now is because when you get it and you've had 2 or 3 shots or 2 or 3 vaccines, you are getting milder disease because of the vaccine. And unfortunately, because viruses, and in particular COVID viruses, RNA viruses, mutate quite frequently. That is their raison d'etre, as we say in French. Their whole mission in life is to replicate and replicate to survive. So when they replicate, they provide new mutations that gives off new variants of concern that have the ability to spread more easily and hopefully not become more severe, which is what's called virulence. If it becomes more virulent and more spread easily, then we have a disaster on our hands, even with all the provisions that we've provided.
As we approach the fall, we're going to see colder weather. People are going to be indoors more. What can we expect as it results to case numbers and the situation with COVID-19?
So, nobody can see in the crystal ball, but we all know that viruses transmit more easily in the winter and fall months because the viruses are able to be transported more easily when it's drier. Therefore, viruses, when they're spread indoor, will be able to be more transmissible. And if we have a new variant by then, now we have the BA5 Omicron variant, which is 90% dominant and has taken over from the BA4, which is now 10%. But if we get a new spin-off of a new variant of concern in October or November, who knows if it's going to become more virulent and causing more severe disease. And those are unknowns that nobody can forecast. All we know is it's going to spread and it's going to mutate and it's going to replicate and we're going to have more variants. That's one thing for sure. And we know that traveling has taken off, pardon the pun, and we know that people are wearing less masks. So when you have that perfect storm, you can probably, with good certainty, say that we are going to get another spike in the fall and winter of COVID-19, whether it's the same virus or a mutated virus. That will for sure happen and cause further sick leave and or absenteeism in the workplace. We just don't know what the actual new virus mutation will be.
Definitely. And we've been seeing, even in our healthcare system in Ontario, hospitals seeing severe shortages and having to stall emergency rooms. Maybe Dr. Burnstein, using this as an example for our employers, maybe not necessarily in the healthcare setting, but in such areas like critical infrastructure, how can they gear up and how can they protect their employees, keep them safe during the coming months?
Well, having a continuity plan is certainly critical for critical infrastructure. So they have to have a plan in place. What are we going to do when 10% or 20% of our employees may be off in a given location or in a given week? They need to have a strategy in place now to address that. They need to be doing tabletop exercises, bring key players to the table, human resources, labor relations, management people, supply, and saying, what happens when this emergency arises? And talking to the union in a unionized environment and making sure they're on board is key, and it should be done now. And then sort of have thoughts in place. Will we bring back masks? And at what threshold will we do that? Will we have people going back to working from home again? We may need to do that. And have the communications in place, the letters written, drafted, that they're ready to go when they cross that threshold. I don't know that barriers serve much of a role anymore. I think we spent millions of dollars on plexiglass in 2020 and 2021. I don't think that has much of a role, but spreading people out more, having great HVAC systems turned on high, and ensuring they're up to date. The HVAC filters have been replaced. All good things for the employers to be doing at this moment in time.
And I think we got to use the 4 Ps of pandemic preparedness and emergency preparedness. It applies to all emergencies, including pandemics. You have to prepare, plan, practice with drills, and have protocols in place before the emergency happens so that you can just pull them out and change the names if need be, to understand what are your 10 most important mission critical items that your company provides. So if you sit down and you write down the 10 mission critical items that your company cannot do without, that is going to be entering in your BIA or business impact analysis. And then you have to have a continuity of operations plan or a COOP for that particular part of your organization. All of those things need to be in place now.
If I might, I might extend that to your key suppliers as well. One of the things that became evident over the last year are supply chain challenges. So you want to make sure that the companies who provide your key equipment, that they've got a strategy in place as well. So what's the oil company that supplies you? What's your phone company doing?
Right. And ordering masks now and ordering hand sanitizers now when there's probably a glut on the market, and not waiting for, when the supply chain is disrupted. I mean, look what's happened to the organizations that depend on Intel chips. You mentioned the hospital shortage. What I've been saying for a long time is hospitals know and emergency rooms know that they're going to have to deal with surge capacity. So if we assume that we're going to have a surge capacity due to COVID and other viruses that are circulating, certainly more so in the fall and December, we should be able to cross-train healthcare workers in not only the ICU, but other disciplines within the hospital to manage patients. And having that cross-training allows you to mobilize and diversify the particular employees in the healthcare space to man the phones or man the COVID line. So the hospitals don't have to shut down. Your ICU doesn't have to shut down. That's my vision. It's not perfect. We're not living in a perfect world.
I'd say that redundancy and cross-training applies to critical infrastructure in every organization. And Alan, you mentioned the flu. Another thing companies can do at this point is plan their flu campaign, because every cold is COVID until proven otherwise. So you want to stop every cold possible. And you may want to, at this point, with school starting in 2 weeks, think about a communication to employees to say, kids are going back to school. There's always an increase in colds in September and October. This is what we expect. And a reminder of these are our policies with respect to your children being sick. I mean, because at earlier stages in the pandemic, when family members were ill, we were saying, you stay home as well. Is that still your policy? So let employees know upfront what they should expect in terms of coming into work, not coming into work with colds in their family.
Communication is a huge element that both of you help your clients with when it comes to an employer's policies and an employer's initiatives surrounding health and safety, and maybe focusing on the fall and right now when it comes to vaccines. Do you feel that it makes sense right now to have employers encourage their staff to get the fourth dose? On the other hand, we hear a lot of talk about the bivalent vaccine that is to come later in the fall. Maybe if both of you can touch on the differences between the two, as some of our listeners may be a little bit confused as to what the fourth dose is versus the bivalent dose that is going to come later. Maybe Dr. Sotto, if you want to start us off.
I will take a stab at it, and I'll let Dr. Burnstein do the bivalent one. But certainly I've been recommending to all my patients and my organizations that I work for that they should not wait for October or who knows when the bivalent will be approved in Canada. It has been approved in the UK. However, one should be cognizant that the bivalent vaccine was designed with Omicron BA1 when it was circulating in December and January. We are now at BA4 and BA5, and who knows where we're going to be in October. There may be a new Omicron variant. That being said, the statistics show that people in Ontario had 2 doses, 87.6%, 3 doses, 62.7%, and the recommendation is from the Chief Medical Officer of Health in Ontario that if you are 5 months from your last vaccine dose, you should consider getting a booster dose. And if you are more than 3 months from your last acute COVID infection, then you should consider getting another booster dose. And so far, personally, I've had 4 doses. We know that if you go from 2 doses, you've got less than 19% antibody protection. When you go to the 3rd or 4th, you boost it up to about 70%. And I'm going to do a plug here for the T cells because your immune system has two plugs. It has B cells, which make antibodies, and then you have cellular immunity, which has T cells, which have T memory cells and T killer cells. And the T cells have been shown to reduce the risk of severe disease and death because they have a longer lasting protection. And the recent study was in March 2022, an Australian study that showed that 15 months after an acute COVID infection or a vaccine, you still had 10 times higher immunity than having no vaccine or no infection. So the antibodies which prevent infection are not as robust or as long-lasting as we'd like them to be, and that's why you need that explanation to go get your third and fourth dose if you qualify and if you have not got it. So that's my plug for T cells.
Great. And Dr. Burnstein, did you want to elaborate on kind of that decision between this and the bivalent vaccine? And maybe if you can explain to our listeners, what is the bivalent vaccine?
First, I'm 100% with Alain. Vaccinate. I know people are experiencing vaccine fatigue, but this virus is wily. And we're not getting the herd immunity and the long-term protection. And these vaccines and the boosters really prevent serious disease and hospitalization. They may not stop you from being infected, but they'll keep you out of the ICU and they'll keep you out of the funeral home. So they are important. And the virus is mutating. They were almost dealing with an completely different disease. Wuhan COVID is almost completely different than Omicron BA.5. So they have tweaked the vaccine. So the traditional COVID vaccine was a monovalent. It was designed against Wuhan. They've now created a bivalent vaccine. Pfizer has one on the go. Moderna has one, which Spikevax, which the UK has approved, and which Health Canada has a deal with Moderna to get 12 million doses for us, hopefully by late 2022 or early 2023. First, of course, they have to approve it, but assuming they approve it, we'll have 12 million doses. But the bivalent vaccine is 50% directed towards Wuhan, the classic COVID, and 50% of it is directed against the spike protein that is found on the Omicron BA.1. Now, admittedly, we're on to BA.4 and BA.5, but there appears, at least in the laboratory, to be an effect against BA.5. And Health Canada is prompting Moderna and Pfizer to further tweak their vaccine, because it's really a matter of just, I know it sounds simple, taking out the mRNA code for BA.1 and putting in BA.4 and BA.5. But hoping that they'll make further adjustments in the vaccine so that when we get it in 2022 or 2023, it may be more specific. But it is a sharper tool. It's going towards the Omicron class of viruses, which are the dominant classes at this point, rather than the alpha, beta, gamma, delta that we were dealing with 6 months ago.
Right. And in your conversations with our corporate clients, when it comes to vaccines and when it comes to encouraging them and encouraging their employees to get vaccinated, do you find that there's specific ways, techniques, strategies that they should be employing to get their staff to get out there and get vaccinated?
In my estimation and my experience, I've seen companies solicit our services through the mass regarding having vaccine town halls or vaccine information sheets, newsletters. That being said, you need to have really properly vetted medical information that is easily transmittable via either a video or a town hall. And I think those were really invaluable, and I think companies need to consider those.
Education and communication critical, and getting key leaders, heads of unions, the CEO of the company, talking together at the town hall, both supporting vaccines. So getting the union leadership to roll up their sleeves and the CEO to roll up their sleeves in support of this is very helpful.
COVID-19 has changed the reality that many of our employees and many of our friends, family live, and their lifestyles have been changed. Their health and well-being has been impacted in many different ways. And some of our clients and some of Canada's largest companies are recognizing this and realizing that this is a time to increase the amount of effort and the amount of thinking on employee health and wellness. What do both of you find your clients focusing on, and what are some of the best strategies when it comes to health and wellness and for their employees? Maybe Dr. Burnstein, maybe we can start with you, and what have you been seeing?
First off, I think you're absolutely right. COVID has shown employees and employers the very critical role that they play in helping employees maintain their health. They've been leaders in terms of promoting vaccination, education, and it has altered, I think, the relationship a little bit and the understanding of the employer's role in promoting health. So what are employers doing? I think they're starting to recognize that they play a very important role in providing health and health information and health care to their employees. And it's also brought to light the large gaps in the public health care system. And the province has been talking about this. Premier Ford has been talking about the role of private care. And lots of smart companies are saying, we can't afford to have the public health care system be the only source of medical care for our employees. With people now routinely waiting 6 months for an MRI, 6 to 12 months to see a psychiatrist, and being disabled or either off work or performing at a lower level, employers are stepping in and saying, we can't afford this. Our employees can't afford this, and are buying medical services. I know this sounds like it's in conflict with the Canada Health Care Act, but they're buying independent examinations with the results going to the treating physician to allow that family physician or specialist to move the care along. If someone's got a bad knee and they're waiting for the MRI, employers are stepping up, buying an MRI, putting employees on a bus to Buffalo, and for $500 getting an MRI, which is 2 or 3 days pay, to allow the person to get better care, which leads to engagement, I think, in helping people have better health and better quality of lives.
Dr. Sotto, what of these considerations ensures optimal employee wellness and staff engagement and staff retention?
The reality in a post-pandemic world now for many workplaces is that we have the great resignation or the great transfer. I mean, you can call it whatever you want, but employees are looking for the next great opportunity, whether it be within the company or a different company. So retention is a huge factor, not only with benefits and other healthcare related perks, but doing health and wellness for 35 years within corporations has really come to play in the sense that the average employee is hungry for medical information that's been vetted and transmitted in a proper fashion, because in the average family doctor interaction, you have 7.2 minutes to address a medical concern. So what about preventative screening for cancer-related things? You want to do other screening that may help your longevity and improve your quality of life. Employees are hungry for medical information. Where can you get that information? In a workplace setting where you have a physician who's able to do a town hall and use the hallmarks of a wellness program. And the hallmark of a wellness program is using the 4 E's. You have to educate employees on the medical conditions that one is trying to screen. You have to empower them with proper vetted medical information. You have to engage them in a conversation about taking ownership for their own health. It's not somebody's going to just do it for me. Well, the company is actually improving the education component. And the final E, where a lot of employers struggle, is how to enable that employee to get the proper next step. And if you apply the 4 E's to your health and wellness programming, you're able to deliver a quality product that will save lives. And then the ROI, which is the return on investment, will be realized in your employees. So, for instance, a town hall to your employees or a health and safety meeting that could be mandatory to allow for an education program for, say, colon cancer screening, which is the number 2 killer in the world, and it's 95% preventable. But most people have no idea that you need to have a screening colonoscopy starting at age 50 if you have no family history, and that's when you should be going for a screening colonoscopy. So it's about prevention, and we know that post-pandemic, a lot of people have put their cancer screening on hold or have delayed it, and we are going to see a tsunami of new cancers that may show up in a much later stage had we done the screening earlier, which is very disturbing, but unfortunate reality. And I think if companies decide to do that, that would be, they would return not only their financial ROI, but an engagement ROI and a happier employee, because now you have employees that want to come to work. My employer cares about me because they're sending me for, as Dr. Burnstein said, cancer screening. They're helping me get the right help. And I think it's terribly important, and it shows that the companies have skin in the game.
Yeah, and that's why they go hand in hand. And I think a lot of our clients recognize that. And if they don't, it's good that they have both of you to help them recognize that employee health is necessary in order for there to be a safe employee population.
If I may, the return on investment for health programs, some of them are almost immediate. There's the engagement that you get by providing services to employees that, again, make the employee feel as if you care. But if you've got someone who's got a chronic condition that's working at 80% capacity because of that, giving 80% effort, they're essentially missing a day a week. So helping them feel better so that they can give 90%, 100% almost immediately makes them feel better, but you get a return on investment from that. I'd also say about the education program, one has to be cognizant that maybe 50% of the workplace will be now at home. And one has to structure programs such that the people at home can participate and be fully engaged in them. Finally, one other really interesting thing that helps engagement and helps promote health is playing with one health benefits plan, changing the plan so it's $1,000 of physio, $500 of psychology. Well, one, bump up the psychology dramatically, but maybe make it more open, like an executive's health spending account. So they can spend it on massage therapy if they want. They can spend it on a psychologist. They can spend it on physio. They can spend it on their gym if they want. But that's a nice perk, and it's focused on health and engages people. And also in the drug plan, one can mine the drug plan data and the short-term disability data to help create really focused interventions. And one of the ones I really like is having the insurance company provide nurse navigators, because the healthcare system is complicated. And having someone to help guide you through, get to the right people, get the right service, can be really helpful, not just for the employee, but their spouse and their children. So it is a great perk. And people, employees, I think, remember that their employer helped them out through that difficult time in their life. And finally, just a plug for mental health, which is, while it may not be the number one cause of short-term disability or long-term disability, mental health conditions tend to start at young age and tend to be recurrent over people's lifespan. And disability durations for mental health conditions are typically twice as long as any other condition, so their impact is that much greater. So having great mental health programs is key. And it starts at the top. The executive should have the mental health first aid training, and then every manager and down, and every union leader.
To Dr. Burnstein's credit, I think the other important aspect is when you decide to do a customized wellness program based on your employee demographics, usage of benefits, etc. Employees want to have that choice to flexible benefits, whether I want to use it for massage or nutritional counseling, etc. And what we've seen is that employees feel better when they have that flexibility. My 3 surprising things that I would do is when I worked for one employer, we increased psychological counseling benefits from $1,000 a year to $5,000 a year, because we recognize that 35 to 40% of long-term disability, and certainly short-term disability, is mental health is responsible for that. So we know that to bridge the gap, we need, because you have to wait so long to see a psychiatrist in Canada and in Ontario, that patients languishing at home without getting proper psychiatric care, but they could get psychological care, that would be terribly important in bridging the gap. And if you increase the benefits, the payoff is that person will likely come back to work sooner. The other out-of-the-box thinking, as Dr. Burnstein has indicated, is paying out of pocket by a company for psychiatric consultations within 2 weeks of a disability. There are organizations that do that now in Ontario, and that report goes to the family doctor of that employee and a phone call from the psychiatrist. Here's what your employee has in diagnosis. Here's the medications I'm recommending, and basically gives the family doctor a recipe with points on how to treat this individual so that at 6 weeks, hopefully they're coming back to work versus being off for 6 months plus. And that is hugely cost effective and brings an employee home back to the workplace and manages their illness. The other thing is to consider paying for private MRIs and healthcare services that are not readily available within your province. And I think that's what companies need to think of out of the box, is paying for an out-of-pocket MRI or a nutritionist, or paying for out-of-province services. I think those are the 3 things that I would add.
And I've got one more that costs nothing that companies could implement, and that's no longer asking for sick notes. They're not worth the paper they're written on. No doctor has ever refused to give a patient a sick note. They clog up the system and they say to the employee, I don't believe you when you tell me you're sick. I need you to go to your doctor to tell me you've got a bad headache today. And with COVID and with colds, we've learned that going to get a note isn't necessary. It doesn't improve the attendance management process in any way. It sends the wrong message to employees. And if you have an issue with attendance, then you can still interview the employee and say, what's going on? You've missed a lot of time. We miss you when you're gone. Is there anything we can do to help you? The sick note adds nothing to that conversation. And 99% of employees are honest, and when they're sick, they're truly sick. And the other 1% probably have some other issue that still needs to be addressed. It may not truly be sick leave, but it's something that needs to be addressed.
Yeah, the last thing we want is to put another barrier to prevent, someone that could spread flu or COVID to coming into the office.
And furthermore, the Ontario Medical Association has indicated that sick notes should not be the sole reason for going to see a doctor. And during the COVID pandemic, they've told doctors not to provide them. So at the end of the day, companies have to pay for sick notes and reimburse their employees. So that's a cost saving right there. Take that money and invest it in health and wellness programming.
All right. What an insightful discussion. Thank you both, Dr. Burnstein and Dr. Sotto. I think there's a lot of good tips here for our employers. And yeah, once again, thank you both for your time. Hopefully we've addressed some burning questions out there.
Thank you for having us.
Thank you.
Stay well, everybody.
That is Dr. Alain Sotto and Dr. Matthew Burnstein, both of Medcan's Medical Advisory Services, in conversation with Mark Beairsto, the MAS Program Manager.
If you'd like to improve the health and wellness programs of your organization, get in touch and book a consultation with the MAS experts by emailing MAS at medcan.com.
We'll post episode highlights and links that you can visit on our website, eatmovethinkpodcast.com.
Say hello and send us a tip or a suggestion by emailing us at info@eatmovethinkpodcast.com.
Eat Move Think is produced by Ghost Bureau. I'm managing producer Jasmine Ratch. Social media and strategy support is from Chantel Gurton, Andrew Imex, and Emily Bozick. Executive producer is Christopher Shulgin.
We'll be back soon with a new episode examining the latest in health and wellness.
This podcast is intended to provide general information about health and wellness only and is not designed or intended to constitute or be used as a substitute for medical advice, treatment, or diagnosis. You should always talk to your Medcan healthcare provider for individual medical advice, diagnosis, and treatment, including your specific health and wellness needs. This podcast is based on the information available at the time of preparation and is only accurate and current as of that date. Source information and recommendations are subject to change based on scientific evidence as it evolves over time. Medcan is not responsible for future changes or updates to the information and recommendations and assumes no obligation to update based on future developments. Reference to or mention of specific treatments or therapies does not constitute or imply a recommendation or endorsement. The links provided within the associated document are to assist the reader with the specific information highlighted. Any third-party links are not endorsed by Medcan.